So let's talk about the peripheral nervous system. Now, the peripheral nervous system interacts with the central nervous system. Central nervous system is the brain and the spinal cord, and so I think of the central nervous system as anything that is surrounded by bone. Outside of the central nervous system, we have the peripheral nervous system. The peripheral nervous system consists of cranial and spinal nerves. That is, nerve tracts that have exited the between the vertebrae and are now in the outer parts of the body. So now we have peripheral nervous system, which is cranial and spinal nerves, and we have two divisions here. We have a sensory, which is everything we feel, also some things we don't feel. For instance, we have nerves that are involved in digestion that we don't even think about. So we have sensory and we have motor. And the motor consists of somatic, which has to do with the body. That's what the term somatic means. And so it controls skeletal muscles. Now, should note that the somatic nervous system can be taken over and used involuntarily as part of the autonomic nervous system. So if you end up getting really cold, then your body will take over, or your brain and spinal cord will take over and start you shivering in a way that you can't control. And that's the autonomic that's helping it along. Now, the autonomic is strictly involuntary, and it controls smooth muscle largely, a variety of smooth muscles. We've got around the vessels that we can increase the diameter or decrease the diameter to improve blood pressure. We have smooth muscles that work on the digestive tract. We have smooth muscles that activate numerous glands. So we have all of this going on without us thinking about it. When I think of autonomic, I think automatic. That autonomic or automatic system has two subcategories. We have the parasympathetic, which we often refer to as the rest and digest. It calms things down, slows things down. And then we have the sympathetic, which speeds things up. So it's sort of like through the course of the day, you've got one foot on the brake and one foot on the gas, and they're balancing each other out all the time, either slowing us down or speeding us up, depending on what we need done. Now, types of reflexes. So let's talk about types of reflexes and regulation, which occur and are regulated by the peripheral nervous system. And a lot of this is the reflexes tend to be autonomic, although there are somatic reflexes as well. We have autonomic reflexes that regulate smooth muscle. So activate or alter the diameter of vessels so we can alter blood pressure. It regulates heart rate so we can increase or decrease our heart rate without having to think about it. Regulates glands, causes them to secrete substances or not, and works with the digestive tract to help us, to facilitate digestion of food. Now, the spinal cord, which is where most of our reflex activity occurs, is a cord that extends from the base of the skull at the foramen magnum down to L2 or L3. We have actually 5 vertebrae, lumbar vertebrae, and then we have the sacrum below that also have nerves in them, but the place where it is all one piece ends about L2 or L3, and it splits up into this thing we call the cauda equina, which means horse's tail, and it's a collection of individual nerves that are hanging down and passing out between the vertebrae. So the spinal cord, along with the brain, form the central nervous system. and the spinal cord functions in these spinal reflexes that we were talking about. It also integrates information, summarizes information, takes stuff that is, again, inhibitory or excitatory, and kind of sees if there's any action that needs to be taken and integrates that before booting anything up to the higher systems. And the spinal cord, those white tracks, those are like a highway for information to travel to and from the brain. So here we have a view of the spinal cord, and you can see we have actually several groups of nerves that we refer to as a plexus. We've got a cervical plexus, a brachial plexus. We have nerves that exit between each vertebrae. So the overall shape of the spinal cord is a flattened cylinder. It's about 16 to 18 inches long and about 3/4 inches in diameter. In adults, it ends about here at L2. In babies, it ends down here between L4 and L5. So as we are growing, the spinal cord itself stops growing about the age of 5, and as we continue to grow, it just pulls the spinal cord up through L4 and L3, but the remaining nerves continue to go down. Now, it also has two enlarged areas. We have a cervical enlargement that's at the neck, and this accommodates the limbs, the arms, and we have a lumbar enlargement down in the lumbar region, which accommodates the limbs of the leg. Now, spinal cord anatomy, you can see here we've got the brain, we've got the skull, we've got the spinal cord exiting, and you can see this cervical enlargement. And then it goes further down and enlarges at the lumbar region. So this is the inferior part of the spinal cord, and this is where what we call the cauda equina. And as you can see here, this is the end, really, of the solid part of the spinal cord. And then these nerves are the cauda equina. And as you can see, they extend all the way down the sacrum, and there's actually one little nerve that goes out the coccyx. Just another picture to give you an idea of what we're talking about. Now, the gray matter in the spinal cord is a little bit different than in the brain. The gray matter in the brain is scattered on the outside or periphery of the brain, whereas in the spinal cord, the gray matter is located here in the middle, in this H-shaped area. There is a little crossover that occurs, so we can have reflex activity that I step on a nail with my right foot. I'm going to also improve my balance on my left foot as I take my hand or take my foot off the nail, and so forth. So the gray matter is nerve cells, unmyelinated axons, dendrites. The white matter, that's myelinated nerve fibers. Now, white matter, again, covers the outside. There are different horns and different columns, and they carry different types of information to different parts of the brain. I'm not going to require that you know all of these different tracks, so you don't have to know the posterior white column, you don't have to know the lateral gray horn or anything like that. One thing I would like you to know is that we have a posterior dorsal ganglion. And what happens here is that we have sensory nerves that come out, and there are bodies of other sensory nerves here that sync up with those that are in the spinal cord. The anterior root, that tends to be motor fibers, and those go straight from the spinal cord out to wherever they're activating. Now, we've already talked about that. We've got dorsal, posterior horns, anterior ventral. Not anything else to tell you, except that the central canal, which is this little opening here, is filled with cerebral spinal fluid, and that also surrounds and cushions the spinal cord. Here's another view of the spinal cord, just a nice graphic here. So we have sensory nerves on the posterior part. We have motor nerves on the anterior part. These combine together to form a complete spinal cord with both sensory and motor characteristics to it, which go to the various parts of the body. Now, let's go. We've got some wrappings. We have surrounding the spinal cord itself the pia mater, which is just an extension of the pia mater that's on the brain. Same thing with the arachnoid mater, which is that spider webby looking, and the dura mater. So these are all continuous with the structures that surround the brain. Now, spinal cord anatomy then, it is protected by the same meninges that cover the brain. Spinal nerves will leave at each vertebrae, and again, the dorsal root is associated with sensory, and that's where we have those dorsal root ganglia. The ventral root contains axons going to certain muscles and other structures. If you were to cut the spinal cord in half, you would see that the spinal cord is not as big as the opening. What it is that the spinal cord is suspended, kind of like it's in a hammock, and surrounded with cerebral spinal fluid for cushioning. And it's got these little ligaments. They're called denticulate ligaments. Again, that's a word that you don't have to know, but those extensions keep it hanging like a sling. Now, mentioned before that the spinal cord's ends at L2. A very helpful thing. Well, it's a very helpful thing that it does that, because that means we can get a lumbar puncture without damaging the spinal cord. See, the spinal cord's like here, and say that's the body of the spinal cord, and these are the nerves that are hanging down. Well, if I take a needle and I'm not real careful, I could go in and do damage if I hit here. But if I go in down here, what's going to happen is that those hanging nerves, the part of the cauda equina, can just be pushed off to the side without us doing damage to the individual nerves. So this is where we're able to get cerebral spinal fluid and do so without causing permanent damage to the spinal cord when we do it. There are some reasons why we would want to be able to access the spinal cord and do a lumbar puncture. So we might sample cerebral spinal fluid for diagnostic purposes. So if a person has a contusion in the brain, if you draw out cerebral spinal fluid, you'll find blood in it. We can also diagnose if there's an infection in the brain. And because we can't get stuff to cross the blood-brain barrier, we are able to inject antibiotics or anesthetics into the cerebral spinal fluid, which then will get carried to the brain and help. Also, we talked about hydrocephalus a little earlier on in a previous presentation. And so we can measure the pressure of cerebral spinal fluid, and if there is too much pressure, there is a means we can use to relieve that. Now, the spinal reflexes are automatic responses to changes in the environment. They're integrated in the gray matter of the spinal cord. And some examples of this include somatic reflexes like the knee kick. You thwack someone in the right spot on the knee, and that's going to cause them to kick. And that reflex is actually one that helps us maintain our balance.